What's up, rookies? Welcome to the Rookie Pharmacist podcast, where we showcase what pharmacists do and explore inspiring pharmacy career paths. Today, I am so excited to have with me Dr. Liv Swonger, but I'm just going to call you Liv because, you're my girl. Welcome. In honor of Pride Month, I really wanted to talk to you and share your journey, your pharmacy journey. I met you on Instagram and um, you call yourself the queer pharmacist. I thought that was just so bold, so courageous, so brave, and you have an amazing pharmacy journey as well. So in honor of Pride Month, I wanted to have you over here and share your story. So welcome, Liv. How you doing?
Oh, thank you so much for having me. I'm so happy to be here.
I'm even happier that you're here. So let's start with my favorite question that I like to ask all my guests. What inspired you to pursue a career in pharmacy?
Yes, that is such a great question. I love pharmacy, but it
Mhm.
really actually didn't start out that way. I have a lot of history and I had a previous career, if you will, before pharmacy,
Hmm.
while I was trying to figure out what I was doing.
Mhm.
So in my journey, I was an emergency medical technician. I was also a certified clinical hemodialysis technician. So I had some
What?
of these small jobs, or entry level jobs, if you will, in the
Huh,
healthcare profession.
huh.
Well, I really figured out what I wanted to do. So I looked at nursing, I looked at physician, but ultimately I landed on pharmacy and I absolutely love it here. It's my
Awesome.
passion, it's what I love
Mhm.
to do.
Mhm.
And you think I would have figured that out a little bit sooner. My mother, my grandfather, and my aunt are all pharmacists. And so
No
I'm a
way.
generation pharmacist. And oh, I love it so much. But I have
Okay.
an intense love for science. I have since the start of childhood, and really
Mhm.
connecting that with patient care and being able to serve my patients is really where it's at. So it led me to
Awesome, awesome,
pharmacy.
awesome, awesome. I mean, you should have just gone with pharmacy right away. You have that family history.
Yeah, I grew up in my
But
grandfather's pharmacy, so
yeah,
I feel
yeah.
like it was always in my blood.
So cool, so cool, so cool. So you decide on pharmacy.
Mhm.
So where do you go to pharmacy school? What have been some key moments or achievements in your pharmacy career so far?
Yeah, I graduated from Idaho State University College of Pharmacy last year
Okay.
in 2023.
Okay.
I'm from Alaska, and so I was actually on their Alaskan campus, and I
Ah,
loved working and going on rotations in Alaska in the health system that I wanted to work in. So it was a real privilege to be able to go to school in my home state. I
yeah.
would say like one of my biggest achievements in pharmacy, in my pharmacy very short career and academia,
Uh-huh.
was I received the Outstanding Student Award with Idaho State University. So I
Wow.
was picked out from the College of Pharmacy to represent a student from each of
Hmm.
the colleges within Idaho State University.
Okay,
And
okay.
so I was chosen out of my graduating class as the outstanding student. So
Oh,
that
cool.
was, yeah, I was really thankful for that just because
Okay.
I'd done so much work in school and it was really nice to be rewarded for that. And then I would say my second biggest achievement is finishing residency. So I'm finishing that up next week. I'm so thrilled to start my career, to get it off the ground. Uh,
Wow. Wow.
yeah,
Wow.
so
Wow.
it's been a journey to say the least.
Yeah. So I thought you were gonna say your one part of your achievement was graduating from pharmacy school, because girl, that alone is an
Yes,
achievement. Okay.
you know it.
So you're an outstanding student from Idaho State. You match into residency program that you're completing now. And then
Yep.
are you doing a second residency or are you going straight into work?
I'm going into my career, girl, pediatric. I'm going into pediatrics, and I'm hoping to
Cool.
work my way into emergency medicine as well.
So
So,
cool. So cool. Congratulations. I'm
thank
so proud
you.
of you. I'm so happy for you.
Yeah.
All right. So let's get to know you a little bit better on the personal side.
Yeah.
Like I mentioned earlier in the beginning, you are known on social media as queer pharmacist. And I
Yes.
was even so, I don't want to say shocked, but impressed to see when you sent me your email address that it's right there in your email address.
Yep.
Um, so tell us more about yourself, a little bit of your personal journey, and how has your sex and gender identity influenced your journey in becoming a pharmacist, if at all?
Yeah. So my name's Liv, and as you said, I'm Queer Pharmacist on Instagram. I'm so happy to be here and to share my story.
Yes.
One of the things that you'll get to know about me is I am unapologetically myself. I thought I'm
Mm-hmm.
authentic. I love being that way. I love
Mm-hmm. Mm-hmm.
expressing myself and
Mm-hmm.
really
Mm-hmm.
embracing my queer identity. So I am a cisgender,
Yeah.
bisexual, queer, and my pronouns are she, her.
Okay.
So
Okay.
yeah, and I love being who I am, and I find joy every day in being in safe places and having my queer family and surrounding myself with a support system.
Mm-hmm. Mm-hmm.
And if you know me, you know that I am proud and out. I'm authentic. I love talking about it. I love shining as a queer person. And um, so I think we're going into your question about like how has my identity been influenced my journey as a pharmacist.
Yeah.
I will say it as I am authentic in everything that I do, but it really took a journey to get there. And
I bet.
as I was going through pharmacy school, even as I like start through my career, I think that sometimes living authentically can be difficult, especially in like professional settings,
Mm-hmm. Mm-hmm.
where sometimes my purple hair and my facial piercings and my tattoos are not the status quo always.
Right, right,
So
right, right.
I think sometimes, I have had those feelings of where I have had to be better and I've had to do better and do more to
Mm-hmm.
sometimes I feel like make up for the fact that I'm queer in a sense that it
Mm-hmm.
was like a strike against me that I was queer. And so I would always try to do more and be more,
Mm-hmm.
potentially so that
Mm-hmm.
people could look past
Mm-hmm.
that.
Mm-hmm. Mm-hmm.
And now I have been able to kind of grow beyond that and understand that if people value me and they value my lived experience and kind of having that diversity, I think it's okay,
Yeah,
it's
yeah,
okay to be yourself. And if people value you,
yeah,
they'll think that too.
yeah,
So,
yeah. No, I don't know you personally. I haven't known you personally for that long, but that was the first vibe I got from you, that you're
mhm,
just so authentic and that you're so happy with being who you are.
yeah.
And I could see that shine through you. And I just always wondered how that um translated in the world of pharmacy. Because like you said,
Mhm.
the color of your hair, whether you're queer or not, or whether
Oh,
you're
sure.
whatever you
Yeah.
identify as not or not, the color of your hair, if you have tattoos and piercing, that already gives a non-professional type
Hmm.
of vibe. But
Yeah.
I think our community has to look beyond these things and realize that what really matters is the love and the passion that we have for what we do and what we actually do and how we care for our patients. Right. So and I appreciate that you mentioned that being authentic doesn't just happen. It's something that we all strive to do, but society and perceptions and expectations sometimes derail that journey to authenticity. So I am so happy that you have found it and that you're blessing the pharmacy profession with. I really appreciate your authenticity with yourself, with us, and with
Mhm.
the pharmacy profession, because it truly makes me happy to see you shine as who you are. So thank you, thank you, thank you.
Yeah.
You did speak about that authenticity journey and having a few challenges with that. Were there any specific challenges you encountered throughout your pharmacy journey specifically with that?
Yeah. So I will say that I do have a level of privilege as I am a passing cisgendered white woman. You know what I mean? And I think sometimes
Yeah,
of
interesting.
those who have different identities, they don't always have that. And so I can
Mm.
choose to disclose or not disclose my sexuality, whether or not I feel
Interesting.
comfortable in a situation. And
Okay.
so I
Okay.
just want to recognize that I do have a level of privilege when it comes to that, even being within my own community.
Mm-hmm. Mm-hmm.
Going a little bit more into that, I think one of the hardships for me as I was going through my pharmacy career and
Yeah.
going through pharmacy school is that as a queer person making your way through school and making your way through this profession, it's really important to see people that are like you, to see
Mm.
people that are successful and queer. And sometimes that lack of representation can
Yes.
feel a
Yes.
little bit alone, when
Yes.
you feel like you're the only queer person in the room or you're
Yes.
only the queer person in pharmacy, and which of course that's not the case.
Mm-hmm.
But
Mm-hmm.
early on, in pharmacy school, that's kind of how I felt,
Yes. Yes.
and I was
Yes.
like, oh my gosh, am I like the first, you know, person going through pharmacy school like this? Which of course I wasn't, and I was
Of
able to
course.
find
Yeah. Yeah.
community even like within
Mm-hmm.
my own
Mm-hmm.
school.
Mm-hmm.
But sometimes that lack of representation, can be hard, which is why like allyship is so important in these spaces because we
Yes.
are a minority. Um,
Yes.
but whenever you
Yes.
have allyship and you have
Yes.
people that understand you and kind of stand beside you, even if they don't identify with one of our letters in the alphabet soup, but that allyship, yeah, is just so important.
I
Um,
agree. I agree. And so good that you brought that out because that's a challenge with every minority. Lack
yeah.
of representation, lack of people to look up to aspire to be like, because it helps to figure out what directions you want to go to see people who look like you go into that direction.
Mhm.
And whether it's a race issue or gender issue, being a minority and not having that and having that lack of representation is definitely a challenge. So were you able to find any mentors, any allies within the pharmacy profession who helped you navigate these challenges?
Yes, yes, yes. I feel so thankful for
Hmm.
all of the mentors that I had every step of the way of
Yes.
my
Oh,
uh
yes.
with my pharmacy career this far.
Yeah.
Prior to pharmacy school, my mentors during pharmacy school, my mentors in my residency, they have played a vital role in my success and
Hmm.
me being the confident pharmacist that I am today.
Yeah.
And I would strongly recommend any of your listeners to
Yeah.
really seek out that mentorship. I think that it's something that we should give back. That's a way that we can give back into our
Absolutely.
profession.
Yeah,
Because let me
absolutely.
tell you, when you're
Yeah.
talking to someone who's on top of that hill and has a nicer view than where you are, it's so important to have reflections on that. And it gives your mentee kind of
Hmm.
an idea of where they're headed, and like the
Yes.
easiest way to get there. And like we've
Yes.
treaded these paths.
Yes. Yes.
And there's kind of a saying is when you get to the top, like send the elevator back down. So like talk,
Yes. Yeah.
like really, really
Yeah.
supporting those that
Yeah.
are
Yeah.
treading those paths, and we all
Yeah.
have our own journeys,
Yeah.
but
Yeah.
really supporting each other through that mentorship. Let me tell you, it did so much for me
Mm-hmm.
throughout my career.
Oh man,
Oh,
I appreciate that sending the elevator back down
yeah.
because
Yeah.
first of all, having a mentor allows you to know that it's possible. That if they
Yeah.
did it, it's possible. I'm not wasting my time. I can do it.
Mhm.
And people do need help getting to where they want to go. Um, being a pharmacist, being a resident, um, are requirements, but we
Yeah.
do need help along the way. We do need sponsors along the way.
And I will say the other thing that was
Yeah.
monumental for me is early in pharmacy school. So I started pharmacy school in 2019. In 2020, ASHP, listening to their podcast, they actually had a Pride series during
Yes.
2020.
Yeah.
And listening to Lindsay Kelly's podcast about her being a
Ah,
lesbian in pharmacy, even though like I was listening through a podcast, having that lesbian representation and hearing her stories and how she
I'm
didn't
having
get well
goosebumps.
like with the status quo and she went above
Yeah.
and beyond that, and just knowing that I was like, oh man, a lesbian pharmacy is so cool. So
Oh
But
man, I'm
yeah, because
having goosebumps
when
right
you're a baby
now
pharmacist,
because
coming in like, oh,
yeah,
it means so much. And
yeah,
it was so revitalizing for me. And I
yeah,
think that that really
yeah,
empowered me as a
yeah,
pharmacy student to
yeah,
be successful and to be that leader and
yeah,
to really be that representation for
yeah,
others, that were
yeah,
coming after me as well. So
yeah.
Daniel Koba, who's the editor-in-chief of
Yes.
AJHP, he's also
I,
gay.
I don't know him, but I know him. Like I
Yeah.
do listen to the SHP podcast, and I've listened to so many of his podcasts because that podcast series really helped me realize that people of the LGBTQ plus community are going through challenges that are similar to what I am going through as a Black person, that I
Yeah.
am going through as an immigrant, as a minority. It doesn't matter what you are, whether you're a pharmacist or Black or queer. I just love listening to people's journeys. They inspire me.
Yeah.
And that's how I landed on that podcast. And let me tell you, I found it so inspiring. It's inspiring and powerful. And in that way, you found mentorship in a way
Mhm.
and
Yep.
inspiration and hope, right?
Yeah. And a testament to that is that mentorship can be found in many different facets.
Yes,
So
yes, yes.
yeah.
Absolutely. Absolutely. Now, one of my other favorite sections, advice. You've given us a few here and there throughout our chat
Mhm.
today, but I would like to ask you, what advice would you give to young sexual and gender minority individuals who are currently considering a career in pharmacy or going through their career in pharmacy?
Yeah, I love pharmacy, and I know we both have sentiments with
We
that,
both
which is
love
why we're here.
pharmacy. Yes.
So it's a very fun profession. I absolutely love it, especially if if you are like a STEM undergraduate, really considering pharmacy with the science that goes into it and the patient care application. I just love that. But
Okay. Okay.
from an LGBTQ plus standpoint, I think that there's a lot of work that needs to be done for our community and by our community, if you will. And the
Mm-hmm.
more representation that we can have within our profession, the more that we can understand our populations, their needs, whether that
Mm-hmm.
be in research, whether
Mm-hmm.
that be in direct patient care, whether that
Mm-hmm.
be, in
Mm-hmm.
whatever part of pharmacy you're in. I think that there's
Mm-hmm.
work to do with it.
More representation.
And
Yeah.
there are things that are very specific to our populations, understanding HIV treatment, PrEP, also like gender affirming care and
Yeah.
hormone therapy. Like there's
Yeah.
so many ways that you
Yeah.
can go in it
Yeah. Yeah.
to directly serve LGBTQ plus people. So
Yes. Yes.
so many opportunities regardless of what you do. But even if you don't go directly into those things,
Mm-hmm.
really just you being who you are and being in our profession is enough.
Yes. Yes.
So,
I agree 100%. So, what I heard was there's place for you. There's
yeah,
work for you to do in this profession that we love so much. And
yeah,
then the other thing I heard was be authentic, be yourself.
mhm,
Um, and I think you mentioned representation
mhm,
in pharmacy, but and I don't think it's so much that people of the LGBTQ plus community are not going into pharmacy. It may be that they are into pharmacy, but they're not out and open and being themselves. So
mhm,
I think things like the podcast series by ASHP that you mentioned really will and continues to inspire people to be authentic and be themselves
mhm.
and show other aspiring pharmacists that they can be who they want to be
Yep, that's
in the
right.
pharmacy profession and in any profession. Cool, 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 cool. You're still young, but I know, and you've been so authentic about your journey. But what advice would you give your younger self?
Oh, my younger self. Ooh, I would, that's a
Yeah,
good
yeah. Go ahead.
one.
Go ahead.
I think my journey in being authentic
Uh-huh.
has been a lot, and it has been ever evolving. But if I could tell my younger self,
Mm-hmm.
I would say you're going to get there. Let
Yes,
me tell
yes,
you, it's
yes,
awesome.
yes.
It's
Okay,
awesome.
it's
It's
awesome.
awesome when
Yeah,
when I'm practicing as a pharmacist. And I think as your listeners, if they're students in here, as you graduate and you're working in the profession and you're doing all the pharmacist things, and you're able to also bring parts of you into that work. It's just it's so fulfilling, and it just gives you purpose. And this is something that I have built for years and years, and telling my younger self, hey, like, you're gonna get there. It's gonna be awesome. Keep going.
yeah.
Um,
It's
that's
tough,
that's
but
the
you're gonna
message I
get
would
there.
send.
It's tough. It may look like you're not gonna make it, but you will. Okay, so cool. Thank you, thank you, thank you. We talked about representation in pharmacy, which I think can be linked to pharmacy schools.
Hmm.
What steps, in your opinion, can pharmacy schools and even workplaces
Yeah.
take to create a more inclusive environment for LGBTQ plus individuals?
I think that there's many things that institutions can
Mhm,
do to
mhm,
really create inclusive spaces, and really this just the celebration of the diversity of voices, whether that's queer people or racial minorities or gender minorities, or really just fostering diversity of thought, experience. It just brings so much more, I think, to teams and organizations. But
okay.
as far as like action items that I think organizations and workplaces can do, is culture, really,
Yeah. Yeah.
which
Mhm.
I think that takes everyone to really come in and create that culture, but also language. And this is more directed towards like schools and residencies, but having language
Yeah.
on your website and in your documents that explicitly talk about making safe places for people of minorities, including LGBTQ people.
Mhm, mhm.
Because let me tell you, like, as a queer person, as I was like looking for residencies, I was looking for that language on their websites. And to be
Ah,
honest with you, I didn't apply to any place that didn't have that language.
got
Because if
you.
I'm going to be spending a year of my life somewhere, training, and I want to be able to give to that organization that
Yeah.
has, similar missions and values, but I also want them to value me, value who I am,
Yeah.
the
Oh
experience I
man.
bring.
Yeah.
Um,
Yeah.
and
Yeah.
really, like, as a queer person, it's kind of scary when
It is.
putting yourself in a position where you may not be safe. You may not be able to talk about who you are, or you might have to hide parts of you to
Mm-hmm.
feel safe.
Mm-hmm. Mm-hmm. We
Yeah, so I
look.
would just say like language, and then also any kind of indications. And I would say this is more of like in a clinical space. For like if you're a pharmacist in ambulatory care setting, or a community pharmacy, really giving those indications of safe spaces. I'll tell you, as a queer person, I also look like, do they have a flag in the window, or do they have a pin that says this is a safe space, or
Mm-hmm. Mm.
inclusionary language and policies. But those small things, let me tell you, we pick up on that. So I think it really makes for better care, and it makes people feel safer in healthcare and in our trainings in
So
residency.
interesting. I always thought about that when it came to patient care. Like you
Mhm.
mentioned, the most recent thing you mentioned, like a flag on the window mention letting them know that it's a safe place for them
Yeah.
to be getting their care. But I never really thought about the language on the website for pharmacists
Mhm.
applying for a job or pharmacy student applying for residency. Um, those are such great examples of what workplaces and pharmacy schools can do. And in the beginning, when you introduced yourself, you did introduce yourself as a cisgender, you gave your pronouns, she and her. And let me tell you, those are may seem basic things, but people still struggle to grasp these definitions and be
Mhm.
able to refer to people the way they would like to be referred as. And even on my patient's chart, sometime it's I still see a person identified as a female, but it's only in their notes that I
Mhm.
read about them having some kind of procedure or being on hormone therapy, that I know what's going on with the patient. But it would be nice to have something really clear and specific on the patient's demographic, telling me who this patient is, right?
And shout out to our informatics pharmacists who are making that happen.
Yes, 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 yes. So we're making progress slowly but
Yep.
surely. We are getting there, and I appreciate you bringing these up.
Yeah.
Um, are there any specific initiatives or programs that you've been involved with that you think are effective in promoting diversity, equity, and inclusion,
Yeah.
particularly for our LGBTQ plus community?
Yes. I would say the two things for that is I teach a class at my alumni college every year on LGBTQ plus provider healthcare and provider competency. So that is kind of what I give back. I was invited by
Wow.
people to
Where did you
teach
get the
that.
time?
And let me tell you, that is so, oh, it fills my heart so much to be able to do that and to talk to future pharmacists coming in. Just even
Wow.
if it's just introducing them to our community and what it
Mm-hmm.
means to
Mm-hmm.
provide for a queer
Mm-hmm.
person.
Mm-hmm. Mm-hmm.
And then the second thing
There's
is
more.
the podcast that was so inspirational for me for ASHP, Daniel Cobal, listening to Leslie Kelly. I was
Yes.
actually invited to be on that podcast. And
Which
so,
episode? What year? I want to go
yes,
listen.
it was in their
Wow.
2022 series. David Cobal asked me to be on the podcast, and it's still up. It's my P4 journey
I'm
on
checking it out. So June of 2022.
it was June of 2022. Yep.
Okay. Okay. I'll check it out. Look at you
Yeah.
doing so much, and you're doing residency, and you're advocating for your community, and you're
It's
teaching,
what I love.
and
I'm so
you're
passionate about it. I love it
thriving.
every day. And when you are so driven and motivated to just make the world a better place and spread your queer
Yes.
joy, and I mean, I am here for it all. So,
The pharmacy world is so happy and blessed to have you. Let me tell you that. Let me tell you that. Now that you're moving out of residency next month,
yes.
what are your projects and goals in moving forward?
Yeah, so for me it's working my way into my job, it's getting my career off the ground, doing all of the things. And
Do you
also
have a
I
job
really
lined up already?
yes.
Okay,
Yeah, I'll
okay,
be
good.
working as a pediatric
Congratulations.
clinical pharmacist. Yeah.
Congratulations.
I'm so
Congratulations.
thankful to have that opportunity. But really, it's being involved in pharmacy in many different ways. So continuing to teach the class at my alumni college, being
Yeah.
involved in my state association.
Yes.
Whenever we're thinking about the profession of pharmacy, every single one of us, pharmacists, pharmacy technicians, we are the profession, and we can change the trajectory of it by being involved in our state, our national associations. So that to me is one of my professional goals as I kind of get my career off the ground.
I mean, I couldn't have wished better for you. That's the advice I would have given you.
Yeah.
Land a job, which you did, and get involved and give
Yeah.
back,
Yeah.
which are all the things that you have said. So thank you,
I want to
thank
send
you.
out an appreciation for you on
Oh
highlighting the voices
man,
of so many pharmacists, really, because it's so important to get our stories out and to have this representation no matter who you are.
no matter who you
Because
are,
at
and
some point, like people are going to connect with that.
yeah, I
And I
hope so.
think when we see and we hear and we know other people's stories, this is how we learn and grow together
I hope
and
so.
how we can really advance the profession overall. So I love what you are doing.
Thank you, thank you, thank you. It means so much to me, and advancing this profession, which is not which is kind of tossed aside a lot. They don't talk about pharmacy so much. Just don't talk about the work that we do, which, I mean, the doctors can diagnose all they want. Who's going to take care of their medications to treat them,
Mhm.
right? So this is a
Yeah.
very important profession, and I really love sharing our journeys, um, mostly for aspiring pharmacists and new pharmacists who just don't know if they're doing the right thing with all the negative publicity going around professional pharmacy right now and the low enrollments. I think now more than
Yeah.
ever, People need to see that there are people out there like you and me that really love pharmacy, that really
Yeah.
enjoy what they do, and that really make a difference.
Oh, absolutely.
All right, all right, all right. So I think we're gonna leave it here. But before we go, I want to ask you, how are you celebrating Pride Month this year?
Girl, I'm in Denver. I'm gonna have a Denver Pride. I'm so excited.
Oh my
Yeah,
gosh.
before I head out of Denver, I'm gonna enjoy Denver Pride Parade and just
Okay.
be in celebration with my queer family and
Wow.
just enjoy those safe spaces because we didn't
Yeah,
always have them.
yeah,
You know,
yeah,
if you look and really just celebrating on where we have come from, you know, from the
exactly.
Stonewall Rebellion in 1969, the
Yes,
American Psychiatric Association removing homosexuality in 1973. And guess what? We were able to get married from Obergefell versus Hodges in 2015. Like, look how far
yes,
we've come.
yes,
I
yes.
mean, if you look at the progression of gay liberation, we still have a lot of work to do, but
Right.
really these spaces and this month is really for us to just celebrate how far we've
How
come
far we've come.
and just celebrating our existence and
Yes,
just bring everyone together and have a good time.
yes, yes.
Everyone needs a good queer in their life.
Because love is love, right? I mean, what the
Yes.
heck? We've come so
Yeah.
far. We still have a lot to go, but at least celebrating that we've come so far is important. Being in the moment, being present, and appreciating where
100%.
we are now. Thank you so much, Liv, for coming on and sharing your journey and giving so much energy to this platform. I really appreciate you. To any listeners out there, if you have any questions for Liv, you can send them my way and I'll forward them to her. And don't forget to subscribe to this podcast so that every time we have inspiring stories like these, you get notified. And until the next one, love you guys. Stay blessed. Bye-bye.